Best way we see to help improve patient care is first help doctor so that he can spend the time that you deserve. Second, and that translates into everything. Once the process is efficient, you will not have delays in getting appointments. You will know exactly when you go to a doctor's office how much you're going to pay for a treatment. You will know what are the insurance ambiguity involved. They might come back and tell you right away, which in today's world may take anywhere from 6 to 8 weeks before you even know that, hey, certain procedure is covered or certain procedure is not covered in your insurance. So there's a lot of moving pieces here. And I think the biggest role that I see from the AI point of view is providing patients better empathy and better and less ambiguity.
Hello everyone, welcome in the 8th episode of 21 Minute Pharma Edge powered by Game of Pharma. And today we have with us a very special guest, Kapil Shukla sir. Sir is working as a principal architect in Google, building a great product for the healthcare. So welcome on the show, sir.
I'm so happy to be in your discussion and be part of this podcast. So happy to share all my experiences.
Thank you so much. So let's start from a generic question. Okay, how do you feel like how this Indian healthcare system and US healthcare system is different, okay? And you worked in India also, right? And now you are in the US and you visit India regular basis also. So what's the technology adoption rate Indian versus US? Yeah.
Very good question. So overall healthcare point of view, Indian healthcare system is much more simplified, and US is way more complex. So let me give you an example. If you have to go to a doctor in India, you can pick up your phone, you can call. Most likely, you will get an appointment within 2 days. If it is a very, very busy specialist, which is probably one in a million, you will probably get an appointment in, let's say, 20 days. Over here, even for if it is not your regular doctor, you may get an appointment with a specialist or a doctor in 1 month, in 3 months, in 4 months sometimes. And there is no concept of immediately going to a doctor and standing in the line and getting the treatment. So that's the good part. That's the good part about the Indian system. Now, coming to the US system, one of the, even though appointment is later, the process is actually, I would say, the documentation is very, very robust. So anytime you go to the doctor, he has to, there's a law against, there are laws that you have to have a enterprise health record system in your practice. You have to make sure you make detailed notes, and and a lot of it is also facilitated because 99% of the treatment in US happens on the insurance side, while India is all cash business. So you go in, you give cash. So you only get prescription here. In US, you also get like what was the treatment, what did they identify, and a lot more details. So that's, I think, the fundamentally two different experiences for both the health system. Also, every experience has its own challenges. So, to answer your question, technology wise, US is way ahead, but experience wise may not be.
Many physicians, okay. I think in India also, I don't know about much about US, okay. So that patient to doctor ratio, okay, it's not that uh, that can cater patient care much better way, right? So many physicians face sometimes burnout. I think some of the main challenges are their operational and the administration work, right? So for I think for India it can be like to increase the patient pool, handle more patients, right? To manage your team. Okay, these can be the challenges in the US. The list is really, really high, right? Like, so AI is now into the system, right? Like for a marketer like me, right? I use many AI tools on the daily basis, okay, and it make my work so easy way so that I can focus more on strategy. Okay, so how this AI driven system, okay, now these AI driven system, how it can help a doctor, a HCP, a KOL to reduce these operational or administration work and make their life so much easier so that patient care can be a focal point for everyone.
In US system, one of the biggest challenge that they face is that you have so much of paperwork starting from the patient's diagnosis to insurance claims to prior authorization to eligibility to treatment plan validation, giving a consolidated view to the patient before a surgery or a procedure can be performed, like, hey, it's going to cost you $5,000, it's going to cost you $50,000. There's just so much of paperwork that most of the doctors are not even able to pay as much attention to their patients. They're always in a rush because every 5 minutes that you spend with your patient, you have 6 minutes of documentation just by doctor and 2 hours of documentation just by their administrative staff. So it's not very uncommon here to go to a doctor's office and you will hear like three or four people just on the phone all the time, typing fast, talking loud, discussing things and stuff like that. So now, if you think AI, the role AI can play in solving this problem, one is it's actually on the AI assisted decision making. And what I mean by that is not that AI will take doctor's job. It's assisting doctor with the facts and figures, the things that they might have overlooked. The second one is on the administrative side of the house, where a lot of work which is actually done by manually is just maybe being on the call, maybe just noting down some details, taking a large 400-page insurance policy and making sense of it. All that now can be done by AI assisted automation. And then also, it actually protects most of these hospitals and doctors and their clinics here because now you can make sense of the ever changing insurance policies in US ecosystem within minutes. So earlier, if you imagine, let's say you are a doctor in US ecosystem, you accept 10 insurance types in your office, you will end up finding that every insurance changes their policies and regulations every 2 months, and they come in form of a 500-page document. So now you have the tools available that the AI can quickly parse through and tell you what has changed, what has not changed, and provide you a better decision making, not at the clinical level, but at the whole revenue generation level as well. So that's where I see AI will make the biggest splash to help doctors and help healthcare providers here.
I think totally agree with your points, and then like it's a one way, right? It's a one way to just show that if insurance is your like I think 20 or 30% of your work, let's reduce it. I think it's all goes step by step. Okay, so that I think in that product generation phase as well, like how companies are looking at, let's focus on the one problem, eliminate that with the AI, and then later the 360 approach will take it over so that it become very easy for the doctor to handle such kind of things, right? So first, when CRM is building, right, they are just catering to the sales team and they are just trying out to mapping the all leads and all of this stuff, right? Then later the CRM has changed. They included the marketing automation, the sales automation, the personalized approach. So I think in that way only all the products cycle will go, right? So now, if we talked about the patient care, I think patient care is such a important point, okay, that everyone is trying. Like in India right now, Indian government, like the recent budget only, they have put a significant amount of money in healthcare, the AI healthcare side or healthcare technology side. I think their focal point now shifting to a 360-degree good patient care environment, right? And I think it's not happening in next 1 or 2 or 3 years because it's a large country. Same goes with I think US also. When they change into the insurance system, I think their main thing is to put patient care at the forefront, but somehow a good patient care also comes with certain HCP's responsibilities. But just tell me, like, how this with AI system or with technology, how accessible, affordable, and personalized patient care can come into the picture? How?
You said it actually very well, Lokesh. So, if you think about it, what a patient wants when he goes to a doctor or a healthcare provider, he wants, first of all, as they say, empathy. If you feel good about the doctor, a little bit of your pain or a little bit of your, medicine works just slightly better. So, and the problems that you are facing is now doctor is not only treating the patient, he's also responsible for his administrative staff. He's also responsible for insurance claims. He's a business owner, and he is the one who has the expertise to help you. Now, the best way we see to help improve patient care is first help doctor so that he can spend the time that you deserve. Second, and that translates into everything. Once the process is efficient, you will not have delays in getting appointments. You will know exactly when you go to a doctor's office how much you're going to pay for a treatment. You will know what are the insurance ambiguity involved. They might come back and tell you right away, which in today's world may take anywhere from 6 to 8 weeks before you even know that, hey, certain procedure is covered or certain procedure is not covered in your insurance. So there's a lot of moving pieces here. And I think the biggest role that I see from the AI point of view is providing patients better empathy and better and less ambiguity in the whole process. And that's the real goal that when we can achieve by by enforcing doctors, by enforcing their administrative staff with the right tool, by making sure that when they are working hard, they also do not make those administrative mistakes which may jeopardize their revenue generation for the hospital. And you have a happy and healthy ecosystem. So that's what the key role that AI will do in next 3 to 5 years in the healthcare sector.
Right, right. And like as said, right, that government is investing huge amount of money into it, right? They are trying to build a good healthcare ecosystem, right? But I think from a tech innovator point of view, okay, I just want to understand that what type of like strategic initiatives, okay, that government should address, and what type of policy change you want as a healthcare tech innovator, okay, so that it will be easy access for you also to change, to make changes in this healthcare system and make healthcare affordable and accessible.
Yeah, it's actually a very good question. So there was one statistics that I was reading somewhere, and it was that 25% of the diagnosis in healthcare are actually misdiagnosis. And the reason is not because the doctors who are doing it do not know enough, it's just that they do not have enough information about the patient. How can you solve that information challenge? I think even before the AI and has a role to play with it, there has to be data. And I think if there's one thing that I would see from the India centric healthcare point of view is ensuring that every healthcare facility captures the data, detailed information about every patient treatment and what they diagnosed. And now with the single identity that is Aadhaar card available, all this information can be connected into a single pane, so that if somebody who was, let's say, getting treated in a small hospital or a small clinic somewhere in far away from a major metro comes to get treatment in a major city, they have all the records available without forgetting about, oh, 5 years ago I had a seizure, or 6 years ago I had this particular medicine prescribed to me. And that would help significantly a lot to the doctors, to the AI, to the people, which is a health history. So I think if there's just one TLDR I have to give to as a suggestion to our decision makers in the industry or in the bureaucracy and governance, is actually standardizing the data. Now, if you think about it, US, the model was created, but model went bad at some place. And I'll tell you where. Every healthcare provider has to provide the access of data, but there's the standardization of data is optional, which means you can create 5 different healthcare systems who don't talk to each other. But India, because you can call it a starting afresh at this point in time, has an opportunity to even standardize at that data layer, so that all the systems can talk to everybody, all the systems can talk to each other, so that you have, in the end, better decision making for patients and easier access of information for doctors and nurses and the whole chain of people involved when you are admitted in an hospital and helping you out. So I think if there's one thing that I'll bring in there is enforcement of AI, enforcement of data policy, enforcement of data taking by the doctors and healthcare providers, and the standardized data policy. Everything else, I think, will follow. India is very progressive. AI, we are not, if anything, the success of our UPI says that if we have the good technology that makes sense for everybody, we are very, very quick to adopt. So everything else can follow there.
So, totally agree to your point. So let's make it fun, okay? So this podcast, okay? So I will ask you some of the rapid fire questions, okay? You need to just answer in a one word or a phrase, okay? So let's start with the first question. That was the one thing in AI that's all buzz but no real impact.
In the healthcare industry, the changing models. Tomorrow, some new model comes, everybody goes crazy about it. Don't go crazy about it. I think the improvement will be slow and steady. And as the new models come, they will have their role to play. I'm not saying they're bad, but it's just that, if you go to a doctor and say you don't use DeepSeek, then probably that's not the right question.
Doctor or engineer, who will AI replace first?
Well, we be an engineer. I hope it is doctors. I still want to keep my job. But no, I think engineers will be first. It's a very structured thing. It's a lot of manufacturing is already robotic driven and design. So yes, engineers first, realistically.
Yeah, but like just to add my little bit of point, okay. So yesterday I was just watching just some video, and then they mentioned that there is no replacement. It's just that things will improve, and the person that is going with them, I think that's matter of the things. And if today I will start, that tomorrow there will be job, or there will be a job for me or not, I think that's not make sense. It's just that you are thinking very much.
I think, Lokesh, you actually hit on a very important point. I don't think doctors will be replaced, but the doctors will, with AI, will replace the doctors who do not use AI. That I can say. Engineers with AI will replace the engineers who do not use AI.
CA that started using CRMs, or that technology, or the GST filing, or other with the technology, and now they have built a good companies, and the persons who was the only doing work at with their pen and paper, I think they just have good these in their they can sell to a good money.
Correct. They can scale with AI. You can.
One healthcare process which AI could completely automate, no humans needed.
One process which revenue cycle management in healthcare. You in US you have patients eligibility. The doctor creates a treatment plan. It's a whole chaos and list of like thousands of things that are done manually today. That should go away. I mean, that's a painful process. It's a lot of data entry. It's a lot of going from one screen to the other, copying and pasting over. That should not be there.
If you had to name an AI assistant for doctors, what would you call it? Dr. Bot, MadGPT, or CVS?
I will probably call it Dr. Medics.
Oh, nice, nice, nice. So, thank you so much, sir, for your insight, for this insightful discussion. I think I learned a lot. The audience will learn a lot, and there will be so much that we have discussed. So, thank you for your time. And
Thank you, Lokesh, for having me. And it's such a pleasure to talk to you about this stuff. Thank
thank you
you
so
very much.
much. Yeah, that's me. Bye bye.